Good afternoon and welcome to today's COVID-19 update. As usual, I'll pass things over to Dr. Seviour for an update.
Good afternoon and thanks for joining us here today. Since the last media advisory, we have had 9 new cases of COVID-19 in our province. 2 are in Eastern Health. 1 is an individual under 20 years of age who is a contact of a case. The second is between 20 and 39 years of age and is related to travel. 7 are in Central Health and under investigation. 2 individuals are under the age of 20, 2 are between 60 and 69 years of age, 2 between 20 and 39 years of age, and 1 is over the age of 70. There's also 1 new presumptive positive case in Central Health. There have been 30 new recoveries, all in Central Health, leading to 132 active cases in our province. The total number of COVID-19 cases for our province now stands at 1,883. 14 people are hospitalized as a result of COVID-19. 951 tests were completed since yesterday for a total of 313,030 tests completed to date. As we approach Thanksgiving, we know that family and friends are really looking forward to spending time together to celebrate the holiday. But we need to do so safely, being mindful that Delta variant is still present in Newfoundland and Labrador. To that end, that we are strongly recommending that any informal gathering taking place in your home starting now over Thanksgiving and for the next 2 weeks should be limited to 20 people. This is consistent with gathering limitations in the other Atlantic provinces. This will help to limit the number of contacts that each person has to prevent further spread of COVID-19. As the colder weather sets in, we know that gatherings are much more likely to move indoors. When you are hosting or attending an informal indoor gathering, be it in a kitchen, a rec room, or a shed, please remember the phrase, people, space, time, and place. People. Interacting with more people raises the risk of the spread of COVID-19. Space. The closer you are to people, the greater the risk of spread. Time. Risk of the spread increases the longer people spend time together. Place. Indoors activities are more risky than outdoor activities. We continue to see our vaccination rate rise, and that is very encouraging. We are nearing 90% of eligible residents with a first dose and almost 82% of a second dose. Provincially, we have at least 80% vaccinated with 1 dose across all age groups. We put out a call to get vaccinated, especially to those in the 20 to 39-year-old age group. You stepped up and got the shot, and for that, I want to thank you. As Dr. Rahman indicated in his presentation last week, Delta has changed the goalposts for the level of immunity we need in the community. We must remain mindful that children under the age of 12 cannot yet be vaccinated. Yesterday, we added a new feature to the data hub that shows the vaccination rate by regions of the province. This will give people a sense of the level of protection against COVID-19 in their communities. Under-vaccinated regions have a higher risk of COVID-19 outbreaks, and we ask people in those regions to step up and make the choice to get the shot. In recent weeks, there's been much discussion around breakthrough COVID-19 infections. A breakthrough infection is defined as an infection that occurs at least 2 weeks after a person has received the last dose of their vaccine. We know that there will be breakthrough cases. We need to accept that as a part of living with COVID-19. What is crucial to remember is that all the science, data, and evidence shows that the vaccine will reduce the chance that you get COVID-19, transmit COVID-19, and become seriously ill from COVID-19. The outbreak of Delta that occurred in the personal care home in the central region clearly shows the protective impact of the vaccines. Only 12% of residents were infected and none had severe outcomes requiring hospitalization. The vaccine did its job. We need to treat the COVID-19 vaccines as we would our seatbelt when in a vehicle. When we buckle up, we know it is an important and effective tool that keeps us safe on the road. We will be adding another feature to our online data hub that shows the vaccination status of our overall COVID-19 cases, in addition to those with severe outcomes. Severe outcomes will be those who are hospitalized or have passed away due to COVID-19. Since February 28, 2021, when we had our first breakthrough on infection until now, 84.5% of our COVID-19 cases were in partially or unvaccinated individuals, and 15.5% were in people that had at least 2 doses, that were at least 2 weeks past their final dose. 3.8% of breakthrough infections were associated with hospitalization or death. The protection of an individual's privacy has always been a priority for public health. When we report data, we must do so in a way that satisfies the public need for information while ensuring no identifying information is revealed about an individual. We will therefore update the data in this new hub feature after 10 new cases. I know it's been a long and hard and trying 19 months for everybody. No doubt there is pandemic fatigue, and we all want to put COVID-19 behind us. We have come so far since March 2020, when the World Health Organization declared the pandemic. We need to continue our focus on minimizing serious illness and death while allowing society to function. We need to adapt when the risk of COVID-19 is high. We do this to protect those most at risk. This includes seniors, those who are medically vulnerable, and those who cannot be vaccinated, such as children under 12. This is all a part of living with COVID-19. You have shown your commitment time and time again, and it has paid off. We have been successful in avoiding the fate that has befallen other jurisdictions. We are asking you once again to step up your efforts, dust off your public health practices by wearing your mask, distancing from those who are not close contacts, and washing your hands well and often. And most importantly, get vaccinated. For anyone joining us at this moment, we have 9 new confirmed cases of COVID-19 in our province, and our total case count is now 1,883. Before I conclude, I want to acknowledge Mental Illness Awareness Week. Statistics show that 1 in 3 Canadians will experience a mental illness in their lifetime. If the COVID-19 pandemic has shown us anything, it is how important it is to take care of our mental health. Newfoundland and Labrador has a range of services and supports for every age. If you need support, please visit bridgethegap.ca to find a service that is right for you and your family. Take care of yourselves and be kind to one another. Thank you.
Thank you very much, Dr. Seviour. I'd like to begin by apologising to our deaf viewers. We have had challenges securing the services of our sign language interpreters today, and we'll endeavour to do better next time. I also want to acknowledge in Central there was a vaccine issue in terms of distribution, based with some problems with the depot in Central Health. These have been resolved. Extra vaccine is on the way there, and extra human resources to allow the supply chain to continue uninterrupted. We had a further 50,000 doses delivered to the province in the last 24 hours, so supply is not an issue. I think I'd just like to reiterate what Dr. Seviour said, that vaccine works by altering the spectrum of disease. It reduces by a factor of 8 your chances of acquiring COVID-19 from someone who has it. It then significantly reduces the risk of serious disease. It reduces further the risk of hospitalization, which in turn reduces the risk of an intensive care stay or fatality. We have seen the case numbers now start to decline. And again, I must thank Public Health in each of the RHAs, but particularly Central, who has borne the brunt of it, as well as those from Western and Eastern who have helped out. It is by prompt attention to the rapid actions of public health that we collectively have been able to bring these clusters, hopefully, under control. So I would conclude by restating simply what Dr. Seviour said. Get the shot. That is important. It protects you. It protects us all. So with that, Leslie, I'll hand it over to you to moderate the media section.
Thank you, Minister. For the benefit of our speakers, we have 2 media in person and 3 joining by phone. There will be 2 rounds in the question and answer session, which will give each reporter the opportunity to ask 1 question and 1 follow-up per round. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Minister, I want to ask you about vaccines in Central, because we talked to pharmacies that on the same day you said vaccine supply is not an issue, they ordered 10 vials and only 1 of them was delivered. They had to cancel appointments, turn people away who were expecting to get the shot. So explain exactly what happened in this situation and what are we doing to make sure that it doesn't happen again as we try and increase our vaccination rates?
Yeah, that's a very good question, Peter. We worked hard over the weekend to identify the source of that difficulty. We spoke with and communicated with the Pharmacists Association, who weren't actually initially aware of the problem. It would appear that there was an issue with the ordering software from the depot in Central. We have remedied that. Those orders have been, as far as I'm aware, will be fulfilled over the course of the next day or so, and there is plenty of vaccine now heading towards Central. So apologies to those people who were inconvenienced. We will make sure it doesn't happen again.
And I want to ask about healthcare capacity in Central, because the hospitalizations we're seeing are all centered around Central Health. Give me an idea, what has the impact been on the healthcare system there? Have they had to cancel procedures, for example, in order to maintain capacity because they're dealing with this? And give me an idea of how many cases have had to been transferred out of Central because they didn't have the capacity to be able to deal with this surge in cases.
Those are very good questions. I think you could certainly get the real accurate flavour by asking Central Health directly, but from where I've been sitting, where has been significant stress on the COVID unit and the intensive care unit, staff have volunteered to come from Western to help out. Staff have accepted patients for ventilation and for COVID care on the unit in St. John's to try and even the load out a little bit. And I know that there is a redistribution of non-COVID work between Gander and Grand Falls, demonstrating very nicely how those two facilities can work together to provide a complete service to the people of Central. So hats off to the staff in Central Health for a very vigorous response. The details around some of the numbers and such I don't have immediately to my fingers, and I'd hate to misspeak, but I'm sure Central Health will be able to supply those quite easily.
Thank you. Our next questions are from Patrick Butler with Radio Canada. Please go ahead and make your way to the mic.
Hello. More questions for you, Mr. Haggie. There seems to be broad agreement among the unions on the importance of mandatory vaccination for public servants. The rub seems to be when we have to talk about consequences for people who aren't vaccinated. At this point, will unvaccinated workers have to be tested in Newfoundland and Labrador? Are they going to be put on unpaid leave, as we just heard the federal government announce a few minutes ago? What's the plan for Newfoundland and Labrador?
Those are very good questions. We've certainly, through Treasury Board and Human Resource Secretariat, been engaged through Minister Cody's shop with the unions. We were aware of the federal announcement earlier. Our proposals around vaccination will be released, my understanding is tomorrow, and we'll have a more fulsome answer for those questions at that stage.
You've said that there doesn't appear to be a lot of vaccine hesitancy among public servants. But do we actually know how many people in the public service, if we look at, for instance, the regional health authorities who aren't vaccinated at this point, do we have that data?
Again, in terms of healthcare workers, one of our challenges has been the way we collect data. People self-identify as healthcare workers. We know that we have had, I think, somewhere of the order of 20,000 people working in healthcare through the regional health authorities. And we also know from vaccine data that somewhere north of 32,000 people who have identified as healthcare workers have actually received vaccine. The unknown is those individuals who would identify based in community or for agencies and that kind of thing. Certainly, we'll endeavour to update those numbers. I believe they were supplied to your colleagues, but we'll certainly try and get those for you as good as we have them.
We will now go to the phone. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. This question is for Dr. Seviour. Right now, it's only moderately to severely immunocompromised people who can get that third dose of the vaccine. I've gotten a few calls from people wondering why people over the age of 65 are not eligible for that third dose. Why is that?
So we did announce last week that also that dose, a third dose, or what we consider a booster dose, would be given to those in long-term care and congregate living settings, and that will happen. That has begun to happen, and it also will be timed with our flu vaccination in October.
But what about for seniors over the age of 65 who aren't, who are living on their own? What's the reasoning for them not being eligible?
Yeah, so right now we're focusing on those who are in congregate living situations, because that adds an element of risk, because you're actually literally living together. So there's it's easier for COVID-19 to spread in those circumstances. And in terms of those outside and other groups, NACI is looking at all those groups. There were discussions this week, and in fact yesterday at the national table. So those recommendations will be coming, and we will follow NACI's recommendations on other groups that will require booster doses.
Okay, and I wanted to ask you, with the amount of people getting vaccinated down just by the fact that our vaccination rates are so high here, are we seeing much right now in terms of vaccine wastage or vaccines expiring before they can be used?
I'm not aware of significant wastage. I can certainly go back and ask that question. We do track it. We have, the last time that was asked, which I think was 6 or 7 weeks ago, we had lost 220 or so doses of vaccine at that point. But that's old data, and I'm speaking from memory, so happy to get an update for you there, Richard.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Good afternoon. I guess this is for Dr. Haggie. Checked the College of Physicians and Surgeons guidelines on exemptions for vaccines, and there are only two, one being a myo or pericarditis, which is a known rare side effect, I believe, of Pfizer. But the other is allergic reactions that cannot be mitigated. Are you aware of situations in this province where people who do have reactions to vaccines are given it in under different circumstances at lower or varied doses in order to overcome a reaction?
From my perspective, I am aware that there has been the odd case of significant reaction to the COVID vaccine, and there is a monitoring system for adverse effects of vaccines. I don't have any up-to-date data on that, but certainly we can poll that database and see what the latest figures are for you. In terms of how that would be mitigated, that's a clinical practice issue, and I'm really not qualified to speak to that. So I can certainly get you the numbers such as we have.
Sure, okay, thank you. And the other question, I was just curious about the Moderna. You say this shortage in Central was primarily an ordering issue. Are the supply lines of Moderna the same? Have they increased or decreased? How is that going?
Through our vaccine ordering system provincially through the National Operations Centre, it's been changed from a per capita basis, which is how it started, to a pull on demand system. So our vaccine team here would specify how many doses for a given period they would like to have, and we increased that recently in the light of the comments about third doses for a complete primary series for immunocompromised individuals, and also for a third booster dose after the 6-month mark for long-term care, personal care homes. So we look to paint the clinics and order vaccines for the clinics with a margin. That's how it's done currently.
Thank you.
Our next questions are from Jody Cook with NTV. Please go ahead.
Good afternoon. Thank you. In other jurisdictions now, we're starting to see the rollout of rapid tests in schools for some of those populations, including Ontario and Quebec. Is that a consideration for Newfoundland and Labrador?
So we are looking at what other jurisdictions are doing, and we're looking at how it might apply to us. So that is on our sites, and we're considering it.
We've seen public health reroute and sort of bolster vaccination clinics in the areas that really need it right now. But we're also seeing really low rates again, or remaining in Bell Island, 67%, if I'm going off the top of my head, for double vaccinations. What's happening there via Eastern Health or help to try to encourage some of the residents getting access to vaccination clinics?
Yes, certainly we are aware that Bell Island has been a place where it's been difficult to get the uptake up. It's one of only 3 areas now in the province which is what we would call a low vaccine uptake area. My understanding is Eastern Health have been working with the staff at the clinic there, and there is now a proposal for a mobile clinic to go over there. I think it's just at the stage of vehicle inspection, actually, so that should happen probably immediately after Thanksgiving.
Our next questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
A question for the Minister about paid sick days. We've seen a lot of other provinces during the pandemic have brought these in as a way to make sure that people who might have symptoms stay home rather than being felt that they're forced to go to work. Newfoundland and Labrador doesn't have paid sick days. I know that's not directly your jurisdiction, but as the Health Minister and with the message that we've heard from healthcare officials about the importance of keeping people at home, isn't this something that could help reduce the potential exposures and impact that we're seeing of the Delta variant?
Certainly the advice for anyone is if you are sick, stay home. We did introduce through, I think, the Public Service Commission and through the RHAs, the ability to draw on COVID isolation sick leave for up to 14 days under certain circumstances. This, I think, will be part and parcel of our ongoing discussions with the Public Service Commission, Human Resource Secretariat, as far as government employees are concerned, and regional health authorities. But in terms of the fiscal issues around the labour market, that really, as you point out, is not my mandate, and I don't know what leeway would exist there, and I would direct you either to Minister Davis or Minister Cody.
And I want to follow up for a question from Patrick about healthcare workers and vaccination rates. So it sounds like there isn't sort of a comprehensive audit that's been done to ask workers whether or not they're vaccinated. Why hasn't the province done that? A lot of other provinces have been able to say, you know, in long-term care, our rates are this. Wouldn't that be the first step before making them mandatory to at least get a lay of the land to know, you know, in a long-term care home, what percentage of people are and aren't vaccinated?
Certainly from a resident point of view, we know the uptake in long-term care and personal care homes has been excellent, and some of that is captured in the age demographics there. In terms of the way we collected our data at the beginning, it was simply around people self-identifying as healthcare workers, because there is a significant self-managed care market, as it were, in the community sector. I think we have challenges in changing that midstream, and I think the facts of the case are that once one moves to an approach of mandatory vaccination, like the feds have done, for example, the onus will be simply on people to provide proof of vaccination, and then you'll get your numbers accurately at that point.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Minister, you just said that there are 3 areas of the province that you'd call low uptake. What are the 2 other areas, and do we know how we can explain that, you know, the low uptake in these 3 areas of the province?
Certainly, the areas where they are below 80% for first dose is Exploits, Bayvert, and Bell Island. As to why that is the case, I don't have any data on which to base a factual answer. I hear stories and I hear anecdotes, but really I have no facts on which to give you an accurate answer.